Welcome to the last part of the chapter. We are now looking at white blood cells, or leukocytes. They only make up 1% of all the blood cells, so red blood cells are the most common, but they are critical to your health. They are also made in the bone marrow, but they have a nucleus, whereas the red blood cells do not. And the reason for that, I'd like you to think about it for a minute. I mean, what do white blood cells have to do? They need to mount a defense against an invader, but they're not ready all the time. They don't mount the defense until you're sick. So once you get sick, the white blood cells double, and not just double in number, but they go on a real rapid mitosis and to create more white blood cells to help against the invasion. So that's why they have a nucleus. They need to be able to duplicate and go through mitosis very rapidly. And I'm sure you've all heard of leukemia, but it is a cancer of white blood cells. So there are 5 kinds of white blood cells. You need to know all of these, and you will be looking at them underneath the microscope. You're going to look for each one of these. Now, neutrophils are the most common. They do something called phagocytosis, which is where they travel and engulf the invader or damaged tissue. Lymphocytes there are 2 types, B cells and T cells, and they're involved in the immune system. So we'll be talking about lymphocytes in detail in one more week. Monocytes, that's what they're called when they're in the blood. Once they travel into tissue, they're called macrophages, and they are also capable of phagocytosis. Eosinophils get involved when a person has an allergy, so their numbers increase then. And basophils are involved with intensifying inflammation, which is a process that occurs when an invader enters or you get a cut, a sprained ankle. Inflammation occurs as a healing process. Blood platelets, as I've said before, is just a fragment of a cell, and it controls bleeding. So when you get a cut, the platelets start forming or getting stuck at the site of injury, and eventually they clot it off so that the bleeding stops. If it's a small cut, it should happen relatively quickly. Obviously, if it's a large cut, their platelets aren't going to be able to help too much. And they are also formed in the bone marrow. Here's a picture of a platelet, and you can see the fibrin that they form. That is the clotting mechanism. It's a material that is secreted and helps to close off whatever is bleeding. Another thing here is about the blood types. Now, we discussed blood types in genetics, so there's really no reason to go over what happens when you have a donor and a recipient, because we have already gone over the clotting. There is also something called the Rh factor, which I haven't gone into detail on. I think just understanding about the A blood types, all the different blood types, and the reason for agglutination with blood transfusions. I'm not going to go into Rh factor, but it's another antigen, and 15% of the population are Rh negative. So that's the minority of the population. The majority is Rh positive. Now, there is something, though, that's important to realize with Rh factor. If you are pregnant and we have an Rh positive male with an Rh negative woman, and she is carrying an Rh plus child, and that's what the picture is showing. They're showing here the mother's first Rh positive child pregnancy, and she has no antigens or antibodies against the Rh plus antibodies. So at this point in time, there's no problem with having a child that's Rh positive even though she's Rh negative. But once that child's blood gets into hers, she's going to form antibodies. And if she has a second child or other that again is positive and she's negative, those antibodies would go in and destroy the fetus. They give a medication after the first child that prevents this from happening. As long as the mother is under good medical care, this is never an issue. But if the mother is not under good care, as in poor countries, or a lot of, even think of the teens today that don't even find out they're pregnant until too late, and then they don't go for medical care. Those could bring about problems in the future. Now, there are also some circulatory system disorders I'm just going to go over briefly. Atherosclerosis, that is another word, the real word for like hardening of the arteries. Hypertension is high blood pressure. Heart attacks, strokes, and arrhythmias, which is changing the rhythm of the heart. All of those are disorders that are very, very common. And your health over the years can help prevent some of these things, like regular exercise, maintaining your body weight, not smoking, not eating high-fat diet. So there are many things you can do to lower your risk. Some people have very high risk even though they may monitor all those things, because genetically they're going to be predispositioned for this if they have a family history of these disorders. Now, this is showing what happens in a heart attack. A heart attack is also called a myocardial infarction. Infarction means death. And what happens in the heart muscle, remember, it has its own circulation and it needs to get a good blood supply to keep working. It needs its own oxygen and nutrients so that it can continue to beat. So on the left is a normal artery that you can see the muscle. Remember, arteries are quite muscular, and you can see the opening is pretty large where the blood is flowing. It's the light pink area. But the artery on the right is filled with, they call plaque, and that's due to cholesterol buildup or fatty buildup. And you can see how it's closed off or blocking that artery. Well, what happens or can happen is a piece of that tissue can break off. Remember the power of the arteries, and the blood is rapidly flowing through it. It's like a riverbed, and it's a fast-moving riverbed. So think of the water in a river that's moving rapidly. Well, that's what the blood pressure causes inside your blood vessels. And you could tear off a piece of that plaque. And then, because it's damaged, the platelets are going to start sticking to it. And then the red blood cells are going to stick to it. And then that whole blood vessel can get blocked, so no blood is passing to the other side. That's what happens in a heart attack. One of the coronary arteries gets blocked. The other side of the heart muscle that's supposed to be getting the blood supply from that blood vessel is no longer getting oxygen. So that muscle tissue is going to start dying. Without oxygen, cells die. And if you're not getting blood coming through a blood vessel, you're not getting oxygen. Now, if you eat a healthy diet, that plaque won't form. Now, if you happen to have an artery that looks like this, they can go in and they could do a couple of different things. And I think the next picture shows a heart with a blood vessel. Okay, here's the heart. We're looking at the outside of the heart. You can see the coronary arteries that are supplying the oxygen to the heart muscle. And at the very bottom, that gray area is muscle tissue that has died because of that blockage. Now that part of the heart isn't going to beat efficiently, and it's not going to get the blood out. It also can cause a short circuit in the rhythm, or the AVSA node, where it sends the electricity throughout the heart. It could change the rhythm of the heart and cause the heart to go into fibrillation, which is when the heart is not beating efficiently to get blood out to the body. And that's when somebody can die. So when somebody has a heart attack, it's very important to get them to the hospital so that they can try to clear this blockage as soon as possible and prevent damage to the heart tissue. This is the end of the heart or circulatory system lecture, and it's the 4th installment and last.